Hello everyone, this is Dr. Burton coming to you from beautiful sunny Florida, and today we're going to talk about the BBL procedure. This is one of the hottest procedures out here in cosmetic surgery today. A BBL is a liposuction procedure of the torso, which includes the abdominal wall, the flanks, and the back. It can be combined with other procedures such as liposuction of the arms and thighs, but usually it's the lipo of the torso with fatty tissue transfer into the buttocks. And the key to the BBL is to get control of the waist and lower back. If you can control the waistline and the lower back, you should have an outstanding outcome with the BBL procedure. The BBL procedure is done under general anesthesia. This operation takes anywhere from 2 to 3 hours. And following the operation, usually the patient will spend another hour to an hour and a half with us in recovery, and then the patient can go home. The key thing when you go home is no sitting. No sitting on your bottom side for a total of 3 months. And when you sleep at night, sleep on your tummy. And if you can't sleep in your tummy for whatever reason, roll all the way over it and go flat on your back. And whatever you do, do not sleep on your sides. Otherwise, you're gonna flatten your hips out and you're gonna have hips like me, and if you're a lady, that's not a good thing. So once again, sleep on your tummy if you can, and whatever you do, do not sleep on your sides. When you're sitting, your weight's coming down on a point, but when you're lying down, your weight's distributed over a larger surface area. So ideally, I want you to sleep on your tummy, but like I said, if you cannot sleep on your tummy for whatever reason, go all the way over and go flat on your back, but do not sleep on your sides, otherwise you're gonna flatten out your hips. Following a BBL procedure, you can resume a regular diet the night of surgery. You can shower within 24 to 48 hours after the operation. When you shower, simply blot soap onto your body. You use the shower water to rinse off, pat dry, and go back into your compression garment or your faja. What to expect the day of surgery? Well, you're gonna come in, you're going to be greeted first by the OR staff. They're going to take you into a preoperative room. You're going to change clothes. You're going to strip down, take everything off. You're going to put a preoperative gown on. And then I'm going to come in. I'm going to go over your medical history with you again. Now, we've already done this before, but I'm going to do your medical history again just for safety reasons. We're going to go over your past medical history, your surgical history, any medications you might be taking, any allergies. And when I'm done, the anesthesia provider is going to come in and ask you the exact same questions again. We're not doing this to annoy you. We're just doing this for your safety. We want to make sure that we covered all the bases prior to the operation. After I finish asking you the questions about your medical history, I'm going to have you stand up and we're going to mark you with a surgical marker. I'm going to have you point to those troubled areas, those areas that you want us to concentrate on with the liposuction. Where do you want me to take the fatty tissue from? And we're going to mark those areas out so we're all on the same page. And then we're going to have you turn around, we're going to mark your back, and we're going to mark your buttocks. Where are we going to put this fatty tissue in? How are we going to put it? How much fatty tissue do you want us to put into your buttocks? Do you want a nice round buttock? Do you want more fullness in the upper pole of the buttocks? Do you want more fullness in the lower pole? You're going to tell me this, and we're going to mark you in the preoperative room. And then we're going to escort you to the operating room. We're going to place you supine on the operating table. That's flat on your back. The anesthesia team, they're going to introduce anesthesia. The nursing staff, they're then going to cleanse your skin with a surgical soap solution or betadine solution. We're going to drape you and carry out the operation. Once the operation's over, the anesthesia team, they're going to reverse the anesthesia, allow you to wake up, and we're going to escort you to the recovery room. And you're going to spend another hour or so with us in recovery, and then you can go home. One question I often get about the BBL procedure is smoking. And my response is there's no smoking if you're considering a BBL procedure, or for that matter, any elective cosmetic surgical procedure. If you're actively smoking and you undergo a BBL procedure, the fatty tissue that we put into your buttocks is simply going to get absorbed. It's like having a big operation for naught. We can do the liposuction, we can plan this procedure out, we can put the fatty tissue into your buttocks, but if you're smoking, this fatty tissue is going to go away. And not only that, but you put yourself at increased risk for a localized wound infection. So no smoking for at least 1 month prior to the operation and 1 month after the operation. I have a lot of patients who are actually very fit, very trim, and they ask me, can I undergo a BBL procedure? First, what is a skinny BBL? A skinny BBL is simply a BBL procedure on a skinny person. Most people have fatty tissue that we can harvest and transfer into the buttocks. Some people have more fatty tissue than others. But the key to the BBL procedure again is to gain control of the waist and lower back. So we do aggressive liposuction over the waistline, we do aggressive liposuction over the lower back to create the contrast between the flanks and the hips, and also to create the contrast between the lower back and the buttocks. So liposuction is going to be key, and the fatty tissue that we do harvest, even if it's a small volume, we can strategically place this fatty tissue in the buttocks to create the contrast between the lower back and the buttocks and give you that nice S-curve that you want to improve your overall shape. So skinny BBLs, yes, they're difficult, but yeah, they can be done. The BBL procedure is considered a permanent procedure. When we do the liposuction to strip or harvest the fatty tissue from the torso, that fatty tissue is gone. And when we take that valuable fatty tissue that we harvested and transfer into your buttocks, that's also considered a permanent procedure. But sometimes the fatty tissue that we place in the buttocks is absorbed. That can be absorbed due to underlying medical conditions like high blood pressure, diabetes, age, or if you're not compliant and you're smoking, that fatty tissue is going to go away. Another reason why the fatty tissue can go away is because of sitting. So remember, no smoking, no sitting, and maintain a healthy diet and lifestyle. This is Dr. Burton. We're wrapping up the conversation today on the BBL procedure. This is a great procedure. If you'd like to know more about BBL procedures, drop a comment below. And if you think you're a candidate for the procedure, if you want a larger, fuller, rounder buttock or curvier curves, give me a call.